We're going to be talking about the procedure for continuous cycling peritoneal dialysis today, otherwise known as CCPD. In today's discussion, we're going to be going over how to set up the cycler and the supplies you'll need, how to take down the cycler, what if the order changes, what if I need to enter the orders, any complications, and then lastly we'll discuss how do we document this in Epic. So the supplies that you're going to need to do your cycler setup is going to be your cycler drain bag. They come two to a package. You'll need your cycler cassette, and there are two types. One is a 3-prong, then you have a 4-prong cycler cassette. Then you're going to need your cycler bag. Your masks. Your bleach wipes. At the end, when you disconnect, you'll need a mini cap. And later on in the process, we'll discuss your effluent sample bag that you may need. You have a 12-foot extension that could give you a longer line from your drain option to the toilet, or you have another 12-foot extension from the patient to the cycler. So those are all the supplies that you'll need, in addition to the cycler machine. Okay. So this is your home choice cycler. It has 3 buttons: go, which basically means go forward. I want to go on to the next step. Stop, which is stop. I want to explore something further. I want to see something further into the menu, and we'll talk about that here in a minute. Or stop, I want to pause the therapy. I want to wait for just a second for some reason. And enter, which is your yes button. Yes, this is what I want. Yes, I want to make a change. Yes, I want to enter into this menu selection. And the up and down button will scroll you through whatever you see on the screen. The great thing about this machine is it will walk you through every step, and it will also tell you when it alarms what's wrong and will help guide you how to fix it. The other key feature on this machine is the 1-800 Baxter number that you'll also see on the back of the wall. So if at any point you get stuck or something isn't working right for you, you can always call that 1-800 Baxter number, and there will be a person on the end of the phone who has a cycler, and they'll be able to walk you through whatever issue needs to be resolved. So you have your machine. In the back, you have your power cord that gets plugged into a 3-prong outlet, and your on-off switch right next to the power cord, which is a toggle switch. So you'll turn it on. In a moment, you'll hear a beep. There'll be a little green cursor that comes on, and it'll say, please wait while it does some internal checking, and the next thing will be press go to start. Before you set your machine up, You've already gathered your supplies, and that's what we're going to do next. Now I'm going to talk about putting the patient's prescription into the machine. So the physician or the NP will write therapy volume, therapy time, fill volume, and then they'll tell you same dextrose, different dextrose. Well, how do I take it from Epic to the cycler? So you're going to hit the down button, change program. Hit the enter button because you want to enter that menu. It'll say CCPD, IPD. You hit the down button. Your total volume is your therapy volume. So the total amount in whatever time frame, that's what you're going to put in. A typical prescription is somewhere between 12 and 15 liters. So we'll just say it's 15 liters. So you're going to hit enter, and then you hit the up button until you see 150000. 15,000 milliliters is 15 liters. Okay, so 15000. That's our magic number. We're going to hit enter and make it stick. Enter is your yes button. Yes, that's what I want. So hit the down button again. Therapy time. Your therapy time could be anywhere from 8 hours to 10 hours to 12 hours. One of the nice features about this machine is that if you put in a therapy volume, but the therapy time doesn't really work, won't leave you an adequate dwell time, it will alarm and tell you. Okay, so you hit the enter button and you hit the up button. We'll say it's 12 hours. So hit the up button. You can hold it or you can make it go just a little bit at a time. So 12 hours, it's still flashing. You hit your yes, that's what I want. Then hit the down button and your fill volume. That's the amount per exchange that you want the patient to have each exchange, just the specific fill. So typically it's going to be for an adult between 2 and 3 liters. We're going to say it's 3 liters. It should never be more than 3 liters. Hit the up button and it'll say 3000. Hit the enter button. Yes, that's what I want. Last fill volume, that's the last amount that's going to go in that patient. Hit the up button and we'll say it's 3,000 mLs or 3 liters. Hit the enter button again and that makes it stick. Dextrose, same. And then you have your units in kilograms and the patient's weight. And you go back to go. Or stop. It'll tell you check the drain. So when you hear it alarming, you hit stop alarming. If it doesn't like something you've programmed, then it will flash and that means you can make a change. So you hit the up button. We want to know if the patient has more than 2,100 mLs out. So we're telling the machine we're putting in 3 liters. We want to know if the patient has kept more than 900 because what goes in has to come out. And if we're trying to ultrafiltrate and remove extra solution from this patient, extra fluid from this patient, we want to know that the patient, if the patient is not letting go of that extra fluid, right? So we may want to increase this to 2,500. So when the initial drain occurs and the patient drains out say 24,900, I'm sorry, 2,499 cc's, then the machine will alarm. And it'll tell you, I only got 2,499 mLs out on this initial drain. We're missing 1 more ml. Sometimes it's just as simple as making the patient roll from side to side or sitting the patient up. Okay? It can put you into some problem-solving modes. So we're going to hit enter, hit the down button, or hit go, hit stop. We have 4 cycles. We have a dwell time of 2 hours and 13 minutes. And now we're press go to start. So in preparing your patient before you get ready to start your cycler, what you need to do is make sure that the patient's transfer set is out and on their lap. You can use either a towel or a blue pad just to protect your patient's bed covers. And then lay the transfer set so that it's handy for when you get ready to connect your patient.